because that's how it was for me. I felt like I'd got back my life. And then in order to do that, I found out about Georgie and Serpa, and I trained in Georgie's work. I also trained in reflexology, because basically it was just a case of training in something that would allow me to go into the health profession. And I wanted to do something that wasn't going to take years and years and years. And I was quite drawn towards reflexology. I had experienced it myself and felt the benefits. So I thought I'd like to do this. So I did the reflexology, I did Georgie's training, and I decided to set up a business that would help people with pain, with stress-related conditions, basically managing stress, just got to kind of like recalibrating, helping with conditions that I understood to be essentially stress-related. And then so I've been doing that. My business has been running for just under 5 years now, but it was only in the last year that I started to experience perimenopause symptoms. Well, I was actually experiencing them maybe 2-3 years ago, but I was not aware of the fact that I was in perimenopause. And I can go as far as saying that I kind of felt unsupported by the health professions. They weren't really identifying that I was in perimenopause. And it was only when I started getting distinct symptoms like what we all know we connect with menopause, perimenopause, like hot flashes, that I thought, hang on a minute, what if that's what's going on? So then I suddenly realized that other things like brain fog, really bad itchy skin, fatigue, insomnia, then I suddenly started to connect the dots and realize I must be suffering from perimenopause. So I kind of almost came to that realization myself. And then once I did that and I started to sort of work on myself, that's when I realized that there was a niche here for me to tap into, because so many of my clients were struggling and I was able to help them. So I wanted to start to go into this work more and develop it as a niche. But there was overlap with my Serpa work, because it connects, it's all about the stress, isn't it? You can have this perimenopause, but if you're not managing your stress, if you're not managing your sleep, then obviously there's going to be a knock-on effect, and it's going to exacerbate those horrible perimenopause symptoms. So I saw that as a lovely overlap. So all of that wasn't to no avail. And so that's where I am now, and I'm really loving every minute of it and every day of this work that I do.
So I don't know, do you want to give a little bit of synopsis on Dr. Sarno? Because some of the audience will know, some of them might be new to this type of work. Some people might not know who Dr. Sarno is, but we obviously know lots about him. But yeah, would you mind?
We do, yeah. So Dr. John Sarno, yeah, no, of course not. So the late Dr. John Sarno passed away a few years ago now. He, American doctor, specialized in, eventually his work led him to understand that there must be, he believed that there was emotional origin to people's chronic pain symptoms. He was basically, carried out his own research and thousands of patients, that he finally was able to understand that he could help them once he connected the dots by looking at the emotional side of their life, as well as, if there was any physical anomalies. And essentially it was rage, wasn't it? I mean, he writes a lot about rage, underlying anger and rage, underlying all, if you peel back all the layers. And so he's written many books: pain, healing back pain, mind body prescription. There's another one, The Divided Mind. Is that his?
Mind, yes.
Mind, yeah. He's written a number of books, really, really fantastic in his field. And he has a huge following now. I mean, he's everywhere on Facebook, and lots of people know about him. So it was Dr. John Sarno that I just came across him online after I was told I needed to have back surgery, and I was adamant that I wouldn't have back surgery. And it was only through doing my own research that I stumbled across other people that were saying, don't have back surgery. Do you know about Dr. Sarno? Look into his work. So when I looked into his work and I purchased one of his books, then that led me to look more into what he wrote about. But ever since Dr. Sarno, tripping over my own words here. Get excited when we talk about Dr. John Sarno. Since Dr. Sarno, there's been Dr. Howard Schubiner leads a huge movement now in the States, and our European arm is led by Georgie Oldfield, who we trained with. And there are
before.
Yeah, exactly. And she trained with those as well. Dr. David Clark. There's so many really highly qualified professionals.
And that's it, isn't it? There's so many now people that are actually doing the scientific research on this, not just through their practice and noticing that people are getting better when they start asking about emotions rather than just the physical. But there's so many research studies now, and the conference we were just talking about it at the weekend, which was the SERPA pain conference, was looking at the state of the research now and how it has just proceeded and grown over the years. And there's some wonderful studies now that are proven
there are
scientifically
absolutely
what
astounding
we've known
results
as practitioners for a long time.
Dr. Howard Schubiner has taken more of a scientific approach, and he's put out a lot of the evidence that's available now that is able to basically show that there is a correlation between not just emotions, but it can go back to childhood stuff that leads to a heightened sensitized nervous system. So there's a lot of evidence that is showing this now.
That's it. And I guess we can talk about Tor Vega, who's a neuroscience in Canada, who does a lot of research and publishes an awful lot, and Mark Lumley in Australia as well. So and there's also a base in Netherlands that are coming up with lots of research as well. So there's it's now more worldwide and growing month by month rather than just year by year. Thank you for explaining that. So how do you think you were able to take on board those things then, those ideas from John Sarno and Georgie and that work? How were you able to then use that knowledge in your work with clients? Because it's a little bit of a step, isn't it? Doing it yourself is one thing, but trying to teach someone else or trying to help others, knowing that you can recover and knowing that there is this new way. How did that come about? How do you find it?
Well, I'm going to be honest, Tina, it's not easy, is it? It's not easy when you have recovered from chronic pain like what I had, or stress-related conditions, and you've actually undergone that really powerful recovery. You just want to go to the highest mountain and shout out to everyone, this works, this stuff is real, you can get better, you don't have to live like this. But no one listens. Well, very few listen, they just think you're mad. So we've learned that we've made the mistakes. I've made the mistakes over time with my clients. But what I have come to understand now is that there is definitely scope to help my clients with symptoms that they often present with. And a lot of my clients do come to me with stress related stuff. They time and time again, when we peel the layers, I can see and they understand that, they may not call it stress. It might just be overwhelm. It might be lack of self-care, which is obviously what we're talking about essentially today. It might just be that they're in perimenopause and they're overwhelmed with those symptoms. So many different things. But it now more and more they're understanding that this is something that affects your nervous system and it needs a different approach. It needs you to take a step back and take a breath and understand that you can get better. So I've learned so much in my own healing and then training with Georgie's stuff, and then later on I did an online course with Howard Schubiner as well. That was amazing. All the stuff that I read, all the CPD training that I do for even my physical treatments, it all goes back to calming the nervous system, activating the what we call parasympathetic nervous system to help reduce those stress hormones that can build up in the body. All goes back to that. So when I work with my clients, whether I'm doing the physical reflexology or I'm doing the pampering sessions, a massage or whatever, or whether I'm doing, bespoke wellness coaching or menopause coaching, I am working with them to make them understand that, look, let's look at how you can just learn to recalibrate, learn to just take those moments out every day. It's not just about coming to me once a month. I give them nuggets of wisdom to take away, that how they can make small lifestyle changes, really, so that they're not, in that, oh my God, I'm stressed kind of thing. So they learn how to sort of move forward and more empowered, which is what the Serpa course taught us. And it helps us to empower not only ourselves, but our clients too, with these toolkit that we give them.
Yes, yeah. So, I mean, what you're saying then is that you've learned the skills yourself and then had to learn how to adapt them to almost sell the idea of it to clients sometimes, isn't it? It's like you can't just say, oh, you're doing it wrong. The medical profession has got it wrong, because, obviously it's worked for some people for years, and actually it's not about being right or wrong. It's about, this is a new way and it is showing it works. So it's worth a go. And
yeah, you're right. I sometimes, sometimes I find that the clients make it easier for me because they themselves almost come after they've exhausted everything, and they have chosen to go down an alternative route because they're almost disheartened by, the conventional route, or they've found that they're almost dismissed or told that there's nothing to worry about, but yet they still have these symptoms. So when they come to me and present with this, it's almost like half the work's being done. So now what I do is that I don't want to start kind of like overwhelming them or scaring them with scientific terminology. We just peel it back to the basics that, okay, let's look at how we can make some small changes to help you manage whatever it is that you want to manage. And if they come to me for reflexology, they see the powerful benefits behind having regular reflexology. And then what I do is that I like to work with my clients on a journey with them. It's not just a means to an end. I want to work with clients to really help them see results. So those clients that really see value in the work that I do, they stick with me because they know that I'm there to help them in this journey. So I give bespoke aftercare advice, and the kind of advice that I will be giving will be dependent on whatever they're suffering from. But essentially some of the stuff will be coming out of my Serpa training, things that, can work on how you can be more empowered in the face of stress or challenges, how to deal with challenges so that you're not freaking out, like things like mindfulness practice and just a little bit of breath work that you can do during the day that can help to calm down the nervous system when you feel like you're having a moment of panic, and that can just stop things from escalating. And then my clients then see that previously where their symptoms were at a certain level, they start to see that those symptoms get less because now they are not behaving in a way that then, adds fuel to the fire. Basically, they're helping themselves away from my treatment time. In their own time, they're also helping themselves.
That's it. I mean, there's a phrase in CBT that so many people used to use, and I don't hear it quite as often now, but in CBT the idea is to train the client to become their own therapist. We give the tools
Right.
so that you can continue in your own time, because it's only maybe 1 hour a week in therapy or in treatment, and it's 167 hours in your own time. So we have to give the tools to be able to do that outside of the sessions, isn't it? And I think if someone understands that at the beginning,
we do. And you do need to have that relationship with your clients if they're on that. Oh, sorry, did you hear me there? It was glitching.
Yeah, I think you were saying you need to have that relationship with
your clients, because they, like my clients, if they come to me, the regular ones, if they come to me once every 3 weeks or every 4 weeks for a physical treatment, but I like to give them, things to do outside that time. And sometimes it can be self-care through hand reflexology, or some points to work on, acupressure points. And then it might also be other things that I can give them, like maybe I might teach them how to journal, or like I said, the breath work, they like to do that, or other tips that they can help to integrate into their life. which then can make them feel more empowered as well.
Yeah, so this is like almost holistic self-care, isn't it? It's like the body, works of reflexology or the stone massage or something, and then there's the the stuff that you can do to help the emotions outside of that as well, with the breath work, the journaling, the mindfulness. I'm just intrigued by what you just said, because I didn't realize that reflexology can be done on your hand. I know that it's
Oh,
about feet.
yes.
So would you be able to demonstrate a little bit or talk a little bit
Yeah,
about your hand?
I
Because that's
can.
what
I
it's
can
from, I
give
think.
you. Yeah. Well, interestingly, I I've got an Instagram page at Lead Holistic Health, and I did post something about 5 posts ago, which was just a couple of minutes of something that you can do, self-care, hand reflexology, which can help with anxiety and feeling a bit overwhelmed, panicky, feeling, or even I put it out for perimenopause, where it can affect your breathing, sort of like just working on the lung reflex. So on the foot, the lung reflex would be underneath that part, the fleshy part underneath you, just at the base of your toes. But on your hand, can you see my hand?
Yeah.
Okay, so basically you would just, well, put a little bit of oil on your hand so it, you can work on it, just tiny bit of lubricant, and then you would just, I'm trying to work how I would, if I turn my hand around that way. So you can just basically starting from just underline where your fingers are here. And then if you just work down up to about this line here, and you just keep working each line like this, just slowly and methodically. I'm doing it a bit quickly, but just keep it really nice. So sometimes you can feel it sensitive, those pressure points as you're working down. So work down each line really nice and slowly, fairly deeply, all the way to the end. And then you can come back again. And if you do that, repeat that 3 times. That is working on the lung reflex on your hands.
Oh, brilliant. So would that work then for someone with COPD or asthma? Asthma is quite a common one that we have in the group.
It would.
Yeah. So
It
calming the
would. It
breathing,
would.
helping with asthma,
Yeah, it
COPD.
absolutely would. Yeah,
Body
and yeah, you
menopause.
can work on those, yeah, to calm down. And there are other reflex points on the hand as well, that work on the nervous system, which gets affected when you're stressed. So what I sometimes do, actually, people that want to do some wellness or stress related illness coaching, I've had clients in the past where they do a combined program. So they will do 45-minute treatment with me, and they'll do a 45-minute coaching session. So they get best of both. So they leave feeling really lighter, refreshed, re-energized. And they've also had some coaching where they take away some little bit of homework to do that they start to integrate. So that's a really nice, that's another new way that I put together as a new approach to work with some of my clients who like to take a combined approach, have the physical treatment as well.
Because that combines both your skill sets, basically, doesn't it? So
Yes.
it'd be wonderful for someone to experience both. So do you find, or did you ever find, that self-care, for yourself, to do that self-care yourself, like when we're recovering from pain conditions, when your back was really bad, was self-care difficult for you? Or did you take to it okay? Was it something that was like, oh yeah, being told to do this, I'm going to do this? How did you find it?
I grew up in an environment, my parents came from abroad, settled here. They were very hardworking parents. I grew up in a large family where there was a very, very strong work ethic. And I myself, my personality was such that I was a bit of a perfectionist. I quickly learned to worry a lot, overanalyze, have set high expectations for myself, work all the time. I used to work in my father's restaurant business and then go to school the next day, then help with the housework in the evening. I used to worry a lot about my parents and things like that, be a mom to my siblings. So self-care, what was that? For me, as I was growing up, the concept of self-care was alien. It was pretty much you're surviving. My parents were working class. We had to work very hard. It was just survive. You just were in survival mode. as I went through that journey with my pain, I again knew very little about self-care. I carried on in this same way of life with my own as I got married, had children. That spilt into how I raised my children as a perfectionist. It's not,
Mm.
it's a recipe for disaster, raising children, everything, you put so much pressure on yourself, and you set yourself never ending to-do lists, unrealistic expectations, and you put pressure on your family too. And that, unfortunately, I learned the hard way. So self-care was minimal until, again, it was all changed after I discovered the work of Dr. John Sarno. And then when I went on my own healing journey, that led me to understanding the importance of self-care. And when I say self-care, Tina, I mean self-acceptance, self-forgiveness, self-kindness, the kind of things that I didn't afford myself at all. That's when I started to learn, and this is the kind of stuff that I impart to my clients as well. These kind of things are really important parts of self-care. I know we hear a lot in social media, have you done your massage treatments, which are all good. They help to calm down the nervous system. They're really good for helping with stress, taking your time out with those kind of things typically associated with self-care. But we know that self-care is more than that. It's looking after everything, isn't it? And what does it mean to you? It might mean something to you. It might mean something different to me. Essentially, self-care to me is learning to accept yourself and forgive yourself when things don't go according to plan. I was not good at doing that at all. I did not understand how important self-care was. I was a giver through and through. Everybody's needs came before mine. Right from when I was a child, I worried about my siblings, my parents, then, into my own married life. I put everybody's needs always before mine, thinking that's how it had to be.
Mm.
And like they say, you can't pour from an empty cup. I learned that the hard way. So I wasn't good at doing exercise and self-care at all. I didn't understand what it meant. It was something that I probably would have felt guilty about doing. I
Mm.
never saw my mum do self-care. We know that generation of, my mum's now 80, she's going on to 85. And I never saw my mum doing anything for herself. It was all about other people, look after your kids, look after your nieces, look after your nephew, look after your husband, look after your in-laws, everybody except for yourself. So some of that did spill onto me, but now it's different. Ever since I started my own business, you have to walk the walk. So I now approach self-care differently. I do see that it's really, really important.
Yeah. So what would be in your self-care package? If you could sort of highlight maybe 3-4 things that you would try to do regularly to help your own mental and physical wellness.
Yeah, well, at the moment, I would say that self-care, if we could categorize self-care into physical and emotional health, but there's also overlap. I endeavor to do exercise fairly regularly for my physical health. And I know obviously that affects your mental health as well.
Yeah.
So I've always been one to exercise, but there was a period of time when I had all that pain. I had to lose that aspect of my life. So I had a big chunk when I was scared to exercise, which now I know I didn't need to be after, it wasn't anything structurally wrong with my back. So I do have quite a lot of regular exercise in my life, and I try to maintain it. There are times when, you slip, life gets in the way. But running
Forgive
is
yourself now.
yeah, but now exactly. And I don't beat myself up. It's like, I spent probably my whole life trying to be like dieting all my life, as most women do. And then when you fall off that diet, then you're like, oh, it's all gone wrong now. And you binge and you're just depressed. But, see things differently now. So I do running. I've done running for charity for dementia because my mom sadly suffers from dementia. So that makes me view self-care with importance as well because of my mom's condition.
Mm-hmm.
And I work with weights. Like when I say weights, just, like weight training for strength, not for bodybuilding, obviously, kettlebell weight training. And this is specifically because I appreciate how important it is when you get to this stage in your life. For women, it's really important to try and maintain your strength and your muscle mass, because it will deteriorate over the years. So again, these are things that I impress upon my clients, just integrating strength training.
And does strength training help with like things like endometriosis, which is more common after menopause? Does strength training, I mean, I don't know whether you can answer that.
Exercise falls into two categories that will help you, really help you with your menopause journey. That is, one would be what we call the aerobic type of exercise: walking, skipping, jumping, swimming, running, things that gets your heart rate going. And then the other one is, as I've just mentioned, the strength training. If you integrate both of them, I know I'm not a fitness professional, but enough to just give how important it is to impart that. I would encourage women that are going through their menopause or perimenopause to, like, get a professional. If they need a professional, get their doctor's permission to embark upon this journey, but really view it as an essential part of your life. It will help to, reduce your menopause symptoms, manage your brain fog, insomnia, anxiety. And basically also evidence now shows that the 3 conditions that are really big and risky for women entering menopause: cardiovascular disease, Alzheimer's disease, and osteoporosis, brittle bone disease. If we don't want to be suffering from those, if we're blessed to live into the later years, we do need to be addressing exercise from 45 onwards, if we're not already doing.
I think that's probably what I meant. It was osteoporosis rather than endometriosis.
Yes.
So
absolutely, Tina. There is evidence to show. Yes, there is evidence to show that you will strengthen your bones and you will strengthen your muscle and stop your muscle from wasting away. But without a shadow of doubt, exercise is really important. And there will be barriers to exercise for women entering menopause. When I say exercise, I don't want women to be, like, afraid, thinking, oh, that's not for me, because often people think that exercise is like, you've got to get out there running, you've got to start joining the gym. No, we know it can just be moving your body. It's movement, whatever that movement is for you, and enjoying what you do, even if it's just 5 minutes of dancing during the day, playing with your children, grandchildren, going for walks, whatever you enjoy. Still carrying your own shopping as much as you can, so that you're working those muscles.
I was then going to say, it doesn't have to cost anything. You can use water bottles and do weights with them at home. You don't have to go to a gym, do you?
No, you don't. Both of mine don't cost. The running doesn't cost, except for a decent pair of trainers. And I do have kettlebells and weights at home, but once I've invested in them, they're with me forever. So other than that, I work out at home. I just put on some fitness video, and I'm quite self-motivated to do that 2 times a week, even 2 or 3 times a week.
That's it.
So going back to, you were asking me what I do for self-care, so physical exercise. And I also would say, what I do personally, I do things like meditation. Now, when I say I do meditation, I'm not like a massive meditator. I'm not a seasoned meditator. I'm not someone who's can sit and meditate for like an hour, but I try to meditate regularly, even sometimes if I'm overwhelmed, if I'm really tired, if I feel like I just need to shut out and everything and everyone and declutter, quieten my mind. Just 5 minutes you can do. Sitting in silence in 5 minutes can really help you. And sometimes I put on a really nice meditation at nighttime to help me sleep. There are so many lovely people who have done recordings for us on YouTube. They've gone out of their way and they provided beautiful recordings. So I will do that. I will listen to that, and it'll help me to get into a nice sleep. And then if I'm feeling like I've gone through a bit of a stressful time, I'll journal. I'll just journal anything and everything that I need to get out of my head, and I'll just get it out, and then I just feel lighter, tear it up, throw it away. Journaling is really empowering for myself. And then I also trained in EFT, emotional freedom technique, the tapping thing. So I still from time to time use that. And other things that I like to do fairly regularly are just things like if I'm feeling overwhelmed, I'll go on strike with the housework or with the cooking. And I'll just say, I'm not doing it. I will just go on strike. Yeah, because I've I've got 4 children. 2 are at university, but they're still in your life, still
Yeah.
coming and going. And I try to put up, chore lists for the kids. Sometimes I have to bribe them. But, sometimes I'm like, I'm not tackling that laundry for the next 2-3 days, or the ironing basket. You're ironing your own clothes, or you're going to take over the cooking today. Whatever it is that I can do to help myself so that I don't feel like I'm drowning. So whereas before I didn't know how to, where to stop, where to draw the line,
Yeah.
I can put those healthy boundaries on myself now so that I
Yes,
can
that's it.
feel more, recalibrated.
That's it. And that's a big part of what I teach people, is that, like where to draw those boundaries and then how to maintain them, because actually, we don't know. If we've not been brought up in that way, and we are givers, we're people pleasers, we're strivers, we won't always know what to say yes to and what to say no to. So we say yes to everything and end up trying to do it all for everyone. And it doesn't work, and it does wear us out, exhaust us, make us more, give us more pain and more stress. And so, learning to delegate, learning to say no, learning to be more assertive about your needs, understanding your own needs as well,
Yeah,
and when you need to do certain things is really important as well. Do you find that, certain times it'll be exercise?
It is really absolutely right. It is understanding your own needs. And I also treat myself. Oh, sorry, it was glitching a bit there. Sorry, yeah. I also treat myself a couple of times a month. I go somewhere else for, massage, reflexology, a facial, whatever. I'm like, I work hard, and I can't be there for my clients or for my family if I'm not looking after myself. So I ensure that I have my own treatments. And just things like that. We've got a kitten 4 months ago, and it's just amazing how, having a pet, just playing with your pet can make you feel deep.
Yeah, it's another one, isn't it? It's oxytocin. It releases oxytocin when we play with a pet. Pet a pet is part of my plan. It's on, it's in the self-care plan that I give to people. But it's so powerful, isn't it? Just having a cuddle with a cat or a dog.
Yep. Cuddling your petting your cat or dog, hugging someone for, I think they say there was a study carried out with by Harvard University, and I think it said something like it has to be 25 seconds or something, or a minute, in order for all those good hormones to be released in the body. So just obviously can't be hugging.
It has to be a certain, like it can't just be a tap on the shoulders hug.
Casual
hug. And you can do that for yourself. I've just done it. Holding yourself can help with that oxytocin as well. It's like giving yourself a hug. And the other one is stroking your arms, isn't it? It's a show of care.
Havening, the havening
technique is, another one to actually, we can, include these things in our life so easily. They don't take time.
And absolutely, they don't cost or cost any money. And another one which I always share with my clients is breath work, slow, deep, diaphragmatic breathing. And people don't know about this, and I really impress upon them how you can just change your whole day and your perspective on things, gain clarity of thought, just feel recalibrated, stop yourself from having a full-blown panic attack, calm down anxiety symptoms, just by going to your breath and spending 2-3 minutes, maybe 3 or 4 times a day, doing breath work. And I did a bit of slow deep breathing before I came on with you. I was feeling a bit nervous. I thought, I'm just going to do my breathing.
That's it. And I say to people all the time, I tend to do it between every client, because it resets me. It helps me to go, that was that section of my life. This is the next one. This is this moment. And it keeps you in the present, rather than me sitting there with one client and thinking about the last. It's like a divider as well. So using the breath in so many different ways to keep us in the moment, but also to deal with that anxiety, because just activating the vagal nerve by a deep breath will tell the brain it all is okay. And it's amazing how quickly it works.
Yeah, so true. Apparently I read somewhere that I think 40 years ago, the average breath, how many breath cycles we did per minute,
Yeah,
was like a very low amount, like 7 or something, 7
yeah,
or 6. Now it's almost doubled because we're just doing
so
slow,
much.
shallow breathing throughout the whole day. Exactly. And
Exactly.
like I would say, you can't be calm and, your breath, if your breath is slow, you're not going to be stressed.
Mm,
They don't go hand in hand. So if you slow your breath down, you won't feel stressed and anxious.
yeah, that's it. You can't feel anxious emotionally or physically when you slow your breathing. And that is such a key thing for people just to learn, isn't it? It's not, and there's
Yeah.
so much science behind it, and it's not just, one of those sort of magic tricks. It's scientific, it works. Try it, try it now if you need to.
Yeah,
So,
it does. Yep,
so
yep,
many
it does.
different
It
ways,
does.
isn't there, to take care of ourselves, but to integrate it into our life. So do you think, there are specific ways that you integrate them? Do we take care of our needs, um, in any other way that needs to be integrated? Like, do you have set times to do things, or are there cues for you to do things? Because I think that's another thing that often comes up. People don't always know, or they'll have,
Yeah,
I'm gonna
very
start running, or I'm gonna start looking after my health in this way or the other way, and yet we don't carry it through, or we start within a couple of weeks, we've forgotten that that's what we were doing.
Yeah, very true. Yeah, no, you're so right, Gina. It's very true that it takes effort to keep things implemented and, to make something become a really good habit. And I think they say 12 weeks is the period of time that it takes for
Also,
something to become
it's
an
been
established.
said so many times, isn't it? Because there is so many different research studies that say different amounts of time, and
Mm,
actually, it depends on your audience. It depends on the population study that they're doing at the time. So I think it is very individual. It depends what you're learning and what you're doing, to how long it
yeah,
takes to make that a habit for you. But yeah,
yeah,
if you say it's going to take a number of weeks usually, or at least a number of
definitely.
doing, like practices on something, it's not going to happen in
Yeah,
1 or 2.
it is. It is. I mean, I do communicate to my clients that, look, don't give up after a couple of attempts of doing something and it's not working for you, because, like, as we know, it takes time for results to show through. But I give a few rules, like, be persistent with whatever you do, be patient, but also be kind to yourself. Set yourself, if you work with good structure, because everyone's different, if you work with good structure, then just start with 2 things that you're going to want to change in your life. And it might be, okay, I'm not going to have it, I'm going to cut down on sugar, or I'm not going to have that slice of cake at 4 o'clock, or I'm not going to have that can of pop, or whatever it is. Just pick something specific that you want to change and write it down, and then just aim to be consistent with that. And if you want to start doing breath work, put a timer on your phone, an alarm to go off maybe 3 times in the day, and it just says 2 minutes of breath work. And sometimes people have those really lovely smartwatches or
Mm.
smartphones that remind you to do slow deep breathing. I know my sister has one, and she said it works fabulously and has made it become a habit for her. And then just go with that, and then try to stick with it. Like, I myself know that if I don't do my meditation first thing in the morning, and I also do my prayers, which are 5 times a day, so that's fairly good discipline. I'm already good with discipline and self-motivated. But with the other meditation that I do, the sit-in meditation, for anything between 5 and 20 minutes, I try to do it first thing in the morning.
Mhm.
And if it doesn't happen first thing in the morning, it's probably not going to happen, because I've got busy, like most of us,
Mm.
all of us got busy. We've got kids, we've got houses to manage, businesses to run. So try to get up 10 minutes earlier to make sure it happens. And then your body clock will just readjust, and you'll automatically get up at that time. Or if you find that you want to do it at a certain time in the evening, just put it in your schedule, but start with just 2 or 3 things. That's what I did for myself. I try to just, with the exercise, what I do is I lay out my trainers, I lay out my kit beforehand. I have to make it easy for myself, so that
Mhm.
if I'm going to try and get up and do my exercise, I do it robotically, almost like, if I wake up and I think, I need to do my exercise. Today's the morning, I'm gonna do my exercise. And if I think about it, don't think about it. Don't give yourself that time. Your brain will give you 10 excuses why you shouldn't do it today. That's the way we work. Don't allow your brain to throw those excuses at you robotically without thinking. Put on your clothes. Once you put on your kit and your trainers, you just feel like doing it. So I do all of that almost like without thinking. And then once I've put on the workout, put on my kit, I feel I'm ready for it now. And then there's nothing, you know, more powerful than that when you get that endorphin release after you've done your routine and you think, oh, I feel amazing now. So I do that with my exercise. I try to do my meditation at a certain time, and other things like journaling or you know, other sorts of self-care things that I do as and when. If I feel like, oh, I just feel overwhelmed, I'm just going to do some journaling now. I just do it as and when. And other things I would say that I, you know, self-care things are things like what people don't think about. Take yourself off technology for a bit, you know, turn off notifications for 2 hours, because in this present, you know, era that we live in, we get really stressed. We're all being bombarded. You know, let your brain just just slow down from being overstimulated. So turn off the notifications, put your phone in another room. You know, if you need to do that, give yourself that discipline, or say, okay, Sundays 1 till 3, I am not going to go on my phone. Nothing's going to happen. We lived at a time when we didn't have phones. So just, you can do little things like that to put that discipline into your life. And you'll find that if you really want the benefits, you will discipline yourself. But after having said all of that, if things don't happen according to plan, don't beat yourself up. Just say, tomorrow's a new day and I'm going to just start over. Just be kind to yourself and just forgive yourself.
That's it. Every moment is a new moment, isn't it? And we can always start over. Yeah, and I think that's a really good message to remember. There's some really good advice there. Do you want to share either a tip for people watching or a little bit more about how you work with clients, what offers you have, that sort of thing? Are you happy to do that?
Yeah, sure. So my business is a local business located in Leeds, 17 Leeds, and it's called Leeds Holistic Health. So my clients that visit me from the local area or even around West Yorkshire, North Yorkshire, they'll come from outside of town as well. They'll come for, you know, reflexology or the pamper packages, but sometimes they come for the face-to-face coaching, those who don't want to do online coaching with me. And they will, yeah, that's the local sort of community that I serve, but I also do online. I mean, I've got so many ideas in the pipeline, that so many things, exciting things that I want to offer, you know, group work and stress management workshops, etc. But it's just trying to get, you know, the time to do
I
these
think
things.
most
But
entrepreneurs are like that, aren't they? You know, you
I
usually
know,
have lots of things going. Oh, I'd love to do that. Let's wait. Let's
I
do
know,
this
I so
first.
many, I know. Yeah, we have to check it. We have to just check ourselves with so many books we want to read. And you're probably like me, you've got a whole library of them, you
Oh
know,
yeah.
four books on the go.
Yeah, yeah. Oh, yeah. I've got them all around. Is the thing, isn't it? Constantly wanting more, more,
I
more,
know.
and actually knowing that it's not always good to keep taking more. Just start.
Yeah, sometimes we just need to go back to all the stuff that we know, because we probably know a lot and we can help and support our clients with. We've got so much to offer. So yeah, but I do yeah, I also offer online support for the coaching. Previously I was working with chronic pain patients or clients. I am niching more into supporting the women with you know, menopause stuff, but it doesn't mean to say that I don't help the pain clients as well. And like I said, there is often overlap as well in the work that I do. So online, in the treatment room, I have I mentioned that I do lovely pamper packages. So from month to month, I like to create really lovely, exciting new treatment packages that I put out depending on what season it is. I'm currently working on a really lovely 2-hour autumn retreat, sort of spicy pumpkin pamper or something. I'm thinking of something that's seasonal, with nice, pumpkin spice back scrub and foot soak and reflexology and a really nice facial, and like things that make you feel amazing. Women just want to come and just recalibrate and just de-stress and stuff. It's like I want those packages.
Yeah,
I
that's
can't
it.
get myself.
That's the thing, isn't
Yeah.
it? We
So I
design
want,
what we think we need.
yeah,
Mm.
exactly. Yeah. I just want to,
Fabulous
yeah.
tips.
Oh no, I know. Where do you live, Tina?
I'm in Norfolk. I'm on the Norfolk coast.
Oh, oh, I see. Yeah, you can't come.
Bit of a
Not
journey.
every day.
Yeah.
Yeah. So yes, I do that. And sometimes if people want to, jump on with me on a 30-minute free, up to 30-minute free consultation for any wellness or menopause any type of coaching that I do, and they're not sure whether it's the right thing for them, then I offer like a free half an hour where we connect and I just get to know, a bit more about what they're suffering from and how I might be able to help and if I'm the right person for them. So there's always lots, and then I've got things in the pipeline. Retreat for a menopause retreat will be coming up at some point, and I want to do some workshops to help stress management workshops, menopause workshops as well. Hopefully that will be online so more people can access.
Yeah, brilliant. Lots going on. So if someone wants to contact you, do you have a specific email, or are you on social media? How do people go about contacting you?
Sorry, I didn't hear that, Tina. It was all glitching. I think, I
Oh,
don't know if it's my internet. Normally it's okay, but seems to be
yeah,
okay.
I think we're getting most of it. I was just saying,
Okay.
if someone wanted to catch you, if they wanted to connect, is there an email address, or is it your website, social media?
Yeah.
Where's the space to find you?
Yeah. I've got a website, www.leedsholistic.health. That's all one word, .co.uk. That's got lovely information on there. It's also got an online booking system. I've also got email contact at Leeds Holistic Health if they wanted to contact me via email for anything, any queries, anything. If people want to sign up to my emails, I give out regular emails with lovely tips on health and well-being, different topic regularly, or put out information on new treatment offers. Then they can just contact me that they want to sign up for that. And I've also got a page on Instagram at Leeds Holistic Health. Again, I put out quite regularly stories on self-care tips, and try to keep up with my social media posts, and Facebook as well, Leeds Holistic Health. So yeah, they all keep me fairly busy.
Yes, that's it. So number of ways to contact Shaheen, and she'll answer your queries or have a chat and see whether she's the right person for you if you're thinking about counselling or coaching, health coaching, reflexology, for menopause, and maybe that crossover with chronic pain as well. But have a chat if you're unsure. Thank you so much, Shaheen. And do you want to pop those links underneath the video once it goes up, and then everybody will be able to
I will.
contact you if they need to. But thank you.
Well, thank you. No, you're most welcome, Tina. Thank you so much for having me. Honestly, it's been lovely. Thank you so much.
So we'll be back later today, 8 o'clock. We've got Jagantha, and he'll be talking about, again, chronic pain, but from a male perspective, because he's a male coach. We know he's a male coach. He specializes in helping men's mental health, and he's a physiotherapist. So we've got that whole array of mind, body, and coaching for mental health for men as well. So I'm looking forward to that at 8 o'clock. But for now, thank you, Shaheen, and we'll see you soon. Thank you. Take care, everyone.
Thank you. Thank you, Tina. Bye.
That's finished. Yay. Well done.
Thank you.
Are you okay?
Yeah, thank you for having me. It was lovely.
You do all right once you get started. It's the worry beforehand that's the issue, isn't it?
Yeah, it's always like, I suppose if you have sort of an idea of the questions that are going to be asked, and then you end up making too many notes, and then you realize it's just best to just speak off the cuff and it's more natural, and then things just come to your head. There's always so much to say,
Yeah, we know our stuff. You don't need to worry that, you're not going to ever know your stuff. You do. And I think that's the thing,
yeah,
it's having that confidence in ourselves that, we can cope. I talk to people all the
yeah,
time and say, that's the key worry, is I'm not going to cope. And actually we do. We cope with everything that we've ever been thrown. So, you've got 4 kids, you cope. You've got a business,
yeah,
you cope. Remind
yeah,
yourself of
yeah,
that daily, because you don't need to worry. Worry is the thing that we have learned. I was really excited when you said I've learned to worry. We learn that from such an early age because our parents are worriers, and we live in
yeah,
those households that
yeah.
we
My dad was, yeah,
sure.
absolutely. Well, I've managed to do 3 of these now, one with Zoe, one with Georgie, one with yourself. So I'm pretty proud of
Yeah,
myself. So I'll just keep
that's
moving
it.
forward, do as many as I can.
Yeah, you'll have to sort one out yourself. You'll have to
Yeah, I need
organise
to start
something,
getting
or
my
come and
ideas
talk on
together.
your Instagram or something.
Yeah, I need to think about something that I can do, which involves, I want to start doing like little, maybe you could start with little mini interviews, maybe a previous client, or finding another person that I can collaborate with and just popping something, because obviously we know it's all about the videos. So yeah, I need to just
Yeah,
brainstorm some ideas.
that's
I
it.
might come to you for some ideas.
Yeah, do, because actually, as part of what I'm offering here is in the group, is that we're doing self-care and chronic pain and anxiety, but they're for business owners. So they're some people are just starting out, and I've got people that were only thinking about having a business, and now they're going on and sort of setting up a business, and I'm just coaching them a little bit.
Well, I did have an idea. I thought of perhaps doing self-care for women going through menopause, because
Mm,
like I said, self-care is important, because then you can ensure that you are, managing your stress so that it doesn't exacerbate your symptoms. So I think I just need to have a clear head to that. It's because I'm always trying to do new courses. So I'm currently doing this like I'm working with a coach. Well, it's like a whole group, and then I'm also finishing off my menopause online training, and then trying to keep abreast of all of this stuff, and then your social media, and then it's like you've got to make sure you block out a little bit of time in your weekly diary to do just that work. Like,
it sounds like similar to how I was doing. I still get tempted by like I watched a video last night and there was offering a course, and I was like, oh, that sounds brilliant, but it's 6 months.
oh,
And
oh
I was
no,
like, 6 months of work, and that's got 4 courses within it. And I was like, oh, I'm just going to be working more trying to keep up with the course. I
I
need to
know.
say no to these things. I need to just trust that I know enough and that I can do this. And then if I find I don't know enough, I'll find someone to ask.
I know. Honestly, if we just looked back at all the books we've got on our shelves or what we've read, we don't need to be doing any more courses, but I don't know what it is. We just gravitate towards them. We're so excited to keep sucking up more knowledge. It's because we're, like you said, entrepreneurs. We just get really passionate about it.
That's it. And it is a subject that we love, and that's why we're doing it. But it is hard
Yeah.
to juggle that with everything else, and something has to give to make way for something else. And if we can let go of that need to learn, and just do it every so often,
But
or
but the lovely thing is that we love doing what we do, and that's nice, and it shows, isn't it? Because we get really passionate, and then people, they gravitate towards us because we're really excited about the work
yeah,
and about our ability to help them.
yeah.
Oh, well, thank you for giving me the opportunity. I wasn't brilliant with sending out emails to anybody in advance. I just barely managed to get ready for this, but at least it happened. At least I didn't have to cancel. And I managed to get somebody in to help with my mum. So my mum's downstairs now, so I'm going to go and check on her. Yeah.
Oh, thank you for doing it though, because I think it's good to have another person's perspective on the chronic pain side.
I'm glad you asked me, because I mean, whether it brings new clients or not, it doesn't matter. It's just another bit of presence I've got, and somewhere floating around the World Wide Web, somebody will see it, and you never know.
Yeah, exactly. It will, we'll probably get something from it eventually. Can't promise it will be now,
Yes.
but that's the thing. It will live forever,
Well,
And
I must remember to put those links on now when I say bye to you. Well, all the best, and well done to you. well done. Reward yourself next weekend. You've done amazing.
Yeah, I am going to have the whole weekend off because I've not had a full weekend off for a long time.
Oh,
So I need to practice
well,
what I teach. So thank
uh,
you. And you know where I am now. We've got each other's contact details. Do let me know if there's anything, that you think,
I will
oh,
do.
we could do that together or whatever.
Yes,
So that would
good
be,
idea.
I'm
Yes,
sure there's,
good idea. Yeah, we could do something online, definitely.
yes.
Okay, my lovely. Take care, Tina.
Yeah.
Bye.
See you later. Bye.
Bye.
Thank you for watching. Don't forget to comment, like and share if you've enjoyed the video.